For more on this, I'm joined then by the director at the South African Medical Research Council's HIV as well as other infectious diseases research unit, Dr. Farida Abdullah. Dr. Abdullah, thank you so much for making the time. Is the country justified in making the testing of tuberculosis a major priority, especially when you consider that we still have so many other infectious diseases in the country, including cancers that are still affecting so many? Some could see TB as perhaps a lesser significant disease. Is government right in putting priority here?
Absolutely, government is spot on, and I'm happy to say that the science community has been working with the Department of Health to establish these targets. These targets are not just sort of thumb sucks that are coming out of somebody's head. They are based on careful calculations, modeling work to show that whereas we are testing between 2.5 million and 3 million people a year, if we double that number to 5 million, then we will find more cases, treat TB. That will prevent TB from spreading, and it will prevent the number of people dying from TB. So this target is extremely ambitious. It's a bold target, and it certainly makes complete sense.
Even while it is ambitious, Dr. Abdullah, you have to admit it's less than 8% of our current population. At this rate, it's going to take us 12.5 years just to test everyone, if that was the case, if the population doesn't grow over the next 12.5 years. So is that really enough testing?
Yeah, so 5 million TB tests a year is a big number. It's a massive logistical exercise, involves testing all over. But I'm happy to tell you that this is not just testing without any strategy. It's targeted testing. So the testing is aimed at people who are at high risk of TB. And I'll give you a few examples. So people with HIV, and in South Africa, they make up between 50 and 60% of the TB cases. To target people with testing, for instance, at the hospital where I work, this morning, all of our HIV patients were also tested for TB. It's a very specific way of targeting people, finding the missing cases and treating them. In addition to that, as the minister said on previous interviews today, if you have someone in a home who has tuberculosis, then test the rest of the family, all the people living in that home, and especially children. Now, one last point I'd like to make is that at the MRC, we did a big household survey in 2018, and we found that almost half of the cases of TB are what we call subclinical TB. These are people who have the bacterium in their lungs, could even be spreading it, but they are asymptomatic. They don't have those obvious symptoms of TB like blood in the sputum, coughing excessively, losing weight. And it's those people that we have to find. We call them the missing TB patients. And the only way to find them is to increase our testing and therefore our yield and putting those people onto treatment.
Why is it mainly poorer communities as well then? Is that because of a lack of testing, the lack of knowledge with regards to this? What exactly is causing that you have the poorer communities perhaps not knowing and ultimately being more impacted by tuberculosis?
So this has got to do with the immune system, Arabile. Basically, in a country like South Africa, where TB is so widespread, 60 to 70% of South Africans have the TB bacillus in their lung. It's well controlled. It's surrounded by a granulomatous reaction, and we call that latent tuberculosis. So it's very widespread, and more than half of the country, the people living in a country like South Africa, are infected and they have this latent TB, but their immune systems are strong. Their nutrition is good. They don't have HIV, and so they're able to control it. But the people whose immune system starts to break down, that TB bacillus from the latent TB then converts into an active lung disease. So people who are poor, who are undernourished, people who don't take care of themselves because they drink too much or they stay out in the cold. But also in South Africa, people who are not taking their HIV medication, people who have cancer, people who have diabetes, anything that sort of undermines the strength of the immune system.
Yeah.
Those are the people that are at risk of developing this active disease.
Are we really fine, despite the funding cuts from the United States?
No, we're not fine. We're not fine. In fact, I co-chair the TB think tank with Dr. Norbert Njeka, who was interviewed earlier.